my name is Ify. This is Knowledge is Power. So today I am going to talk about teach how to give a hip injection. Okay, so I'm going to use this my dummy as a human being or as somebody that I'm going to be giving the injection today. So, and why do we give hip injections to somebody? We usually give hip injection to somebody who has arthritis pain. We give them some corticosteroid mixed with some lidocaine, which help the patient get better and get relief from hip pain. Okay. Sometimes I will tell you this does not relieve the pain for a long time, just relieve the pain like 3 months or 2 to 3 months. Some people say it's a month. So let's just say 1 to 3 months. So then the patient will come back again. It's something you have to do routinely, like quarterly, twice a year when you have arthritis pain. So to start with, hip injection is something that it's going to be a provider that is going to be giving a hip injection to the patient and not the nurses that will be doing that. All right. So at that point, I usually ask the patient to lay down on. So the side of the hip that I'm going to give the injection is going to be up, while the other side is going to be down. Okay. So looking at this, so this is going to be, I don't know if you guys are seeing this a little bit, if I have to bring down my camera down a little bit, so that way we can all see the hip very well. So I'm going to do this, use that to just roll this. So if you roll it, all right, a little bit more. Okay, great. So thank you. And I now have a camera woman who is helping me behind the screen. She doesn't like her face in the camera anyway, but I appreciate her. She's wonderful. So like I said, so you have, this is the syringe that we use for the hip injection. It's a spinal needle, and then I have the regular disposable syringe here, and then I have my needle. So what we do is we mark the area, and we use the ultrasound machine to look for our landmark. So once you get your landmark, you kind of use a marker to mark the landmark. Okay? And then when you have your marker, then you will give the patient a little lidocaine just to numb the area. All right? So when we introduce the lidocaine, we wait for like 2 to 3 seconds. So the whole thing will kind of go in. That way I also prepare to get my needles, syringes out and get stuff ready for the injection. I open up all the stuff. Most times my AMAs have done some of this for me. So, and then sometimes it's just I'm by myself. So either way, wherever I find myself with, it's fine. So now that the lidocaine has numbed the area within 2 to 5 seconds or so, then I will now introduce my syringe into the spinal needle into the patient's hip. So this is the hip. I will go in the 90 degrees angle following the mark which I put in. Okay, so here we go, and then here is in, and what I do is I take out the needle in from there. This is going to go to the sharp container, and right now the medication is filled in this syringe. So what I'm going to do with this syringe that has all the medications in, let's assume I have medication in, I know it's an empty syringe that I'm showing you guys, but Let's assume I have my medication in there, which is made up of lidocaine and the corticosteroid and all that. So I'm going to introduce it in here, and what I'm going to do is squeeze it in. You see, it's all in there. It's in there. So I begin to push my syringe to go in. So medication is going in. You go in slowly. Make sure you ask the patient, how are you doing? Are you doing okay? You want me to stop? You want me to continue? Anything? Just take it easy. Make sure you listen to the patient and make sure that everything is going on fine. And once you finish, you unscrew the syringe. You put it in the disposable container. And now I have my Band-Aid. And then I take the needle out of the patient and I put my Band-Aid here. Let the patient, you may put a little bit of pressure, but most times you don't really need it. Then ask the patient if she experiences any tenderness or pain. She can also place some ice there. That day, between 40 to 48 hours, she is advised not to do any lifting or anything that will disrupt that heat. Okay, thank you very much, and I hope that I have done justice to how to give injection, the hip injection. If you have any question, if you have any topic that you want me to deal with, I will be glad to work on that. Bye. Make sure you subscribe, and thank you guys for subscribing. I appreciate many of you who are subscribed.